Okay, Dr. Ross, it's all yours.
All right. Thank you very much. Good morning. I'm going to begin today's meeting with a welcome to Amar Alaskari, who is our newest, will soon be our newest member of the board of the Toledo-Lucas County Health District. Our attorney, Kevin Pittick, will swear in Mr. Alaskari so that he can participate in our meeting today. Kevin, do you want to take over with him right now?
Sure. Whenever you're ready, repeat after me. I state your name.
Amar Alaskari.
Do solemnly swear
Do solemnly swear
that I will support
that I will support
the Constitution of the United States,
the Constitution of the United States,
the state of Ohio,
the state of Ohio,
and all other applicable laws
and all other applicable laws
and regulations,
and regulations,
and faithfully, honestly, and impartially discharge my duties and responsibilities
discharge my duties and my responsibilities
as a board member
as a board member
of the Lucas County Regional Health District,
of the Lucas County Regional Health District,
according to law
according to law
and to the best of my ability.
and to the best of my ability.
Welcome to the board.
Thank you.
Thank you, Amar, for joining us. Should we take a moment to briefly talk about Amar? He is a certified public accountant, and those accounting skills will be very welcome on the board. No one on the board has quite the depth of experience and knowledge that Amar does. So we're very pleased to have added that additional expertise to our board. Is there anything you'd like to say, Amar, about the new position for you?
I'm very
Are you
passionate
ready?
about health, and I'm happy to help on the board and be on the board.
All right, thank you very much. We're glad to have you. So we're going to go ahead and call the meeting to order, including you. And so we'll go ahead and proceed. Eric, you want to take a roll call?
Yes, please. Fritz Byers.
Present.
Amar.
Yes, President.
Dr. Fernandez.
Present.
Matt Hireman.
Present.
Ted.
I'm here.
Donald Murray.
Here.
Susan Postal.
I am here.
Dr. Ross.
I'm here.
Barb Sarantu.
Here.
Michelle Schultz.
Present.
And Dr. Donna Woodson.
Present.
We have a full board.
Ready to roll?
You forgot Dr. Monk.
Oh, I'm sorry,
Oh,
Dr.
there he
Monk.
is. Hi, Chip.
He's
I'm on.
pretty
Dr. Monk,
morning.
we're here. Thank you. I was like, one,
he's
two,
pretty
three.
unforgettable, let me tell you.
Okay.
What about Richard? Did we get Richard?
Yes.
You did? I must have missed it. I'll wake up. The coffee will hit bottom in a minute. All right. So,
Thank you.
Do you want to do introductions of guests?
We have, it looks like we have several individuals who are on from the community watching us today, but we do have ONA and ASME on, so, and several staff members, Doctor, but that's it.
Okay. All right. Do we have any additions or deletions to the agenda since it was published?
I do not. I think we've covered everything unless the board has something else they would like to see on the agenda.
So is there anyone who would like to add or delete anything from our agenda today? If not, we'll proceed. Give you another
Dr. Ross,
moment. Yeah.
we will be going to executive session. So
Understood.
Okay.
So our first item of business is to approve the board minutes. Those were all passed out to you. So.
Dr. Monk moves approval.
Just one moment, please, Donna. There were several.
There are more than one set. Yeah, there's more than one set, isn't there?
Yeah, so could I address,
Yes.
and you, if you want to address all of them, but I think we need to take them individually, do we not?
If
Yes,
there are
Dr. Woodson.
corrections, then yes.
Yes.
For the regular Board of Health meeting last month, I did go over them and you can go ahead, Dr. Monk, if you want to approve them, but I have gone over them and
So this
Alice,
was for our November 19th meeting. Donna, you've reviewed those and no objections?
yeah, no,
So
move approve.
we have a motion.
Dr. Ross, I did
Yes.
send Alice a couple of corrections. Just syntax and a couple of things that were out of context, but they don't have any substantive changes.
Okay. Do we need to read those in or are we okay?
I think they're okay. They're just
All right.
a
So go
couple
ahead and
things that
approve.
were-
This is for the November 19th board meeting minutes.
That's
All
correct,
right.
yes.
So we have a motion to approve from Chip. Does anybody else want to second that motion?
I'll second it.
Donna seconds it. Is there any objection to approval of the minutes? Hearing none, it's unanimously approved. Okay, do you want to move on to the special meeting minutes?
25th, Doctor? Yes.
Yeah, these are from the 25th, November 25th. Were there any corrections to those?
I move that they be accepted as submitted. Monk here.
Okay. Do we have a second?
I'll second that. Sue.
Okay, so Dr. Monk, Sue Postal, any further discussion of the special meeting from November 25th minutes? Hearing none, I'll assume that this is unanimously approved unless someone objects. Okay, unanimously approved. Is there a third set? I think there is.
December 3rd, Dr.
Yes.
Ross?
Yes. Dr. Woodson, was there anything from the December 3rd minutes? Was that the set that you had some minor corrections on? Or am I mistaken? Any additions or corrections to the December 3rd special meeting minutes?
I move that they be accepted as submitted.
All right, that's Dr. Monk again. Do we have a second?
I second Fernandez.
Richard Fernandez. Give you another moment. Without objection, the December 3rd minutes accepted unanimously. Okay. Is that it? I think there were
December
three.
8th. I think we have
Pardon?
December 8th.
Oh, that's right. We had another one on the 8th. The December 8th minutes.
Monk moves that they be accepted as submitted.
Okay.
I'll
Dr.
second.
Monk again. Richard
Second
again.
Richard
seconding.
Fernandez.
Any additional comments on the December 8th minutes? All right, we got to move in second that they be accepted without objection. Hearing none, unanimously accepted. Does that take care of our minutes? I think it does.
Yes, it does.
All right,
Yep.
so we'll move our agenda along. Which
Legal
would be-
updates. Kevin, do you need the link for the executive session? You're a little different since you're on the phone.
Yes,
Alice, Shannon, can you please get that to Kevin?
I just emailed Kevin. He's all set. Thank you.
Thank you, Shannon. I appreciate that. Dr.
here it is.
Ross, legal updates?
Yes, you want to go ahead and proceed with those and then we'll move into executive session for after that.
Kevin, do you have anything right now for legal updates outside of executive session?
I'm assuming we'll be talking about the lawsuit, so no.
All right.
Dr. Ross, then I do believe that we can go into executive session.
So we need a motion to go into executive session for the purposes of discussing legal action
Correct.
against the board.
I
So moved, Monk.
I'll second
Okay.
that. Sue Postal.
Sue Postal second.
We need a roll call, Dr. Ross?
Yes, please.
Fritz Byers,
Yes.
Amar Lasky,
You may need to unmute, Amar.
Yes, sorry.
thank you, Amar. Dr. Fernandez,
Yes.
Matt Hireman,
Yes.
Ted Kozarowski,
Yes.
Dr. Monk,
Yes.
Donald Murray,
Yes.
Susan Postal,
Yes.
Dr. Ross,
Yes.
Barbara Sarantu,
Yes.
Michelle Schultz,
Yes.
Dr. Donna Woodson.
Yes.
Executive session 8:47. Board members, you will receive the link for the breakout room. Please push on the link to the breakout room and that will take us to executive session. You should see a join breakout room. Please push join.
So Eric, are you out?
He was going to be the last to leave the break
Okay,
room.
just
I
make sure
believe he's
everybody's out of the
making
break
sure.
room.
Yeah, make
Okay.
sure Dr. Woodson
Dr.
made it.
Woodson,
I think if I, oh, Eric's out. Okay, if I close the room, it's gonna.
force her.
Alice, you're on mute.
She's
Dr. Woodson's having some technical difficulties. So Dr. Ross, do you want to go ahead and get back into session, and then Dr. Woodson can join us?
Okay, so we need a vote to come out of executive session.
So moved, Monk.
There was, we need a second, and
I'll
then,
second that, Sue Postal.
thank you, Sue Postal.
Roll call.
Yes,
Fritz Byers,
Sorry, I was on mute. I'm here.
Yeah.
Yes.
okay,
Amar Latsky,
Yes.
Dr. Fernandez,
yes.
Nat Hireman,
Yes.
Ted Kozarowski,
Yes.
Dr. Monk,
Yes.
Donald Murray,
Yes.
Susan Postal,
Yes.
Dr. Ross,
yeah,
Barb Sarantu,
Yes.
Michelle Schultz,
Yes.
Dr. Donna Woodson. We are out of executive session at 9:38.
so there, correct me if I'm wrong, Eric, but there was no action taken in executive session that requires a vote. So we're going to move to Dr. Cadigan's report. Dan, are you on?
Yeah, good morning. Keep it
Good
brief.
morning.
Medical director's report, obviously at this point with the levels of COVID in the community, it's been the main focus over the last month. I've been working with developing a group of physicians to promote vaccination now that the COVID vaccine is here within the community, trying to put together a group of professionals that are respected within the community, to spread the word on vaccine safety and encourage the public to be vaccinated. We've done some work with regards to continuing to improve clinic flow and efficiency within our reproductive health clinic. And other than that, the only other thing I would have at this point is with the cold weather obviously starting right now, and with the increased risk for medical issues for those that are homeless, I would strongly encourage, as we get into the cold months, those in the community that are able to help to certainly contribute where they can to help increase the ability of people to have shelter and not be homeless, as time spent on the streets or in crowded situations certainly would increase the number of people crowding the hospitals and the emergency room with COVID-19 illness.
Well, under that, I mean, as the board is aware, the end of this month, the eviction moratorium is going to expire. And I'm wondering whether what we should do is at least communicate with the levels of government that might be able to do something about evictions, about our concern, given for sure it's going to increase the amount of homelessness at absolutely the worst time. So I might entertain a motion or a resolution from the board to communicate our concerns about evictions leading to increased homelessness in Lucas County, and therefore increasing our risks of COVID and further deterioration in the health of the community. Is anyone willing to tackle a resolution?
This is Richard Fernandez, Board of Health, City of Toledo. The board does have a prepared resolution that we can bring forward for a vote and present to our health commissioner. If I may, I can read it to us and we can,
please.
I can present it for a vote. Lucas County Regional Health Department has concerns for the health of Lucas County residents due to the tremendous risk of homelessness at this time and during this pandemic. The Lucas County Regional Health Department Board directs the Health Commissioner to communicate with city, state, and federal agencies, urging them to extend the moratorium on evictions. We urge all agencies to take all appropriate and legal remedies. Period. Right. That would be the end of that resolution. I suppose I can move that we pass this resolution as stated.
Monk
we have-
seconds that motion.
All right, Dr. Monk seconds. Do we have further discussion of this resolution? I think the sense of the board is that we certainly don't want more homelessness in the middle of the winter in a pandemic. Okay, so let's take a vote on that. Do we need a roll call or just without objection?
You know, like Kevin would always say, doesn't hurt to do a roll call, so I'm gonna do a
Okay,
roll
let's
call.
do it.
Fritz Byers,
Yes.
Marlaski,
Yes.
Dr. Fernandez,
Yes.
Matt Harmon,
Yes.
Ted Kozarowski,
Yes.
Dr. Monk,
Yes.
Donald Murray,
Yes.
Susan Postal,
Yes.
Dr. Ross,
Yes.
Barbara Sarantu.
Are you muted, Barb?
Yeah, she's muted.
I'm sorry, I got
That's
it.
okay. Barb Sarantu,
Yes.
Michelle Schultz,
Yes.
Dr. Donna Woodson.
Yes.
Thank you. Passes.
All right.
I will take care of that. I'll begin work on that after the meeting today.
Okay, thank you, Eric.
Yes, sir.
Are we now ready to move on to Dan? Or do you have any additional comments from the medical director? Again, thank you for your report. If there are, go ahead. Otherwise, we'll move on to our committee reports.
No other comments at this time. Thank you, Dr.
All right.
Ross.
Thank you for all your work, Dan. I think you've done a great job pulling together a group of informal advisors for the board that will, I'm sure, show its great value over the next year, without any doubt. So I've already talked a little bit with Eric about it, and I think it's having an informal panel of people in the healthcare field that are giving us some additional advice through the medical director. It's a great idea. All right, so audit and finance. Ted, do you want to go ahead?
Okay, I will. Thank you very much. And yes, the Audit Finance Committee, we did meet on Monday and we did have an opportunity to review all the documents that we normally receive. And each of you should have received all those documents prior to the meeting here for your own personal opportunity to review. So I'll try to make this as quick as I possibly can. But what I'm going to require is that I'm going to ask for a motion to approve the November 2020 vouchers. I'd like to make sure everyone has an opportunity to review, and if any questions, we'll try to address them for you.
Ted,
Yes.
Who is that?
it's Donna.
Donna, thank you.
In terms of the vouchers, and would this include, are you including the long list, the list that we have on the Excel sheet,
Yes.
that we can make comments on that?
Yes.
I did have a few questions on items on the Excel sheet, items 33 and 34, regarding virtual training materials for Healthy Start from Florida State University. These are totaling, two of them, $22,600. Is this a one-time fee to get these, I guess, learning modules that we use for Healthy Start? This $22,600 to receive, I guess, training modules for Healthy Start, $22,600. Is this a one-time expense?
Gwen, are you on? Or Tina?
Sorry for the delay. It is my understanding that it is a one-time expense. Tina, do you have any more knowledge on that?
Tina, you're muted if you're on.
And is this something that's used nationally, this $22,000 worth of a module, I guess, across the country? Is it available anyplace else?
Dr. Woodson, I'm not sure if it's available outside of the state of Ohio.
All right, I think, this is a hefty expense, and I think it's certainly Healthy Start is a very important program, but who would know if this is a one-time expense? Is that only, if Tina on, back on?
I
Dr.
can check
Woodson,
on
hey, Gwen, can I make a suggestion? Why don't you contact Codell downstairs and just make sure that is a one-time expense? And I do believe that's being used inside the state. So can you confirm that?
Sure.
Yeah, I mean, was this something that was required of us by the state to track our Healthy Start educational, maybe has a tracking function that allows the state to document to the feds, the fact that we're doing training as well as the other things that we do within Healthy Start.
Dr. Ross,
Mhm.
that was a grant purchased item, so that went through the grant appropriations through the state.
Okay.
But we'll make sure we confirm that. We'll try to get that information before the end of the meeting.
Yeah, this is Richard. I can let the board know that what I'm looking at in front of me right now is the Florida State University Center for Prevention and Early Intervention Policy Training Program, Partners for a Healthy Baby. It is a $425 training program per person that is titled Virtual Partners, or they have various programs, but it's comprehensive training programs that look to train, looks like I would assume members of our staff for supporting the families in the community, to plan effective home visits, promote healthy birth outcomes, support parenting skills that promote optimal bonding. Trainings like this are typically all day, it looks, and it's done through Florida State University as a virtual training program, I see.
All right. Do we know
Hopefully that helps
whether
the board understand?
I mean, our Healthy Start is a partnership, isn't it, Eric, with other institutions in town? It's not just us alone, is it?
That is
It
correct.
is.
It is.
So it may be that we're also training people, or we'll be extending this training to others that are working with us on the Healthy Start program within Lucas County.
Correct. Dr. Ross, I just spoke with Greg Moore. He's the
Mhm.
program coordinator for Healthy Start. And
Okay.
he is with Pathways Hub and the Healthy Start staff here and with Hospital Council. And the
Okay.
training is conducted every 2 years,
Okay.
what I'm just told.
So there's training every 2 years, and this
And it's
is our
within
way
the-
of making sure that we meet that requirement of the grant.
Correct. And it
Thank
is also within the state of Ohio, not nationally.
Okay, thank you.
You're welcome.
Any further questions, Donna? Good pickup on a big.
Not
ticket
right
item.
now. I still, okay, I would like in the future some more information, but we certainly need to go ahead and pay this, it seems.
Okay.
All right, one other, I think two other small things. Item 38, which is under TEMEAKA, that may be a name, and then GRAM, contract services for Medicaid infant mortality, $24,010. What does that involve? Just briefly.
Glenn, go ahead.
This is a Tina question.
Yeah, Tina, we addressed this at the meeting, so let's go ahead and.
Tina, are you
clarify
there?
that.
Where is she at?
Yeah, I was at the meeting. My memory is that this is someone who's a contract employee.
It is.
Right.
And that we're paying them at intervals for their work. And I don't remember, is this someone who's going to become a full-time employee? I think that might come under our personnel report. But this is someone who was a contract employee who was being paid in wide intervals. And that's why it's come up this way.
For
Right.
$24,000 to one person contact.
Yeah.
I don't want to hold things up, but could someone after the meeting at some time within the next few days, let me know a little bit more about this $24,000 expense?
Tina's having a hard time getting on. Sorry, technical difficulties.
Okay. Well, we can always come back to it later with that question to be answered before the end of the meeting, I assume.
That would be fine with me.
Oh,
Like some more
Oh,
information.
hi, Tina.
hey, that contract for Tamika Gray, she's paid quarterly, but she had a name change. So when she had a name change, she had to re-register in the system to correct that, to correct her information. So that's why there was a delay in paying her quarterly. So that's why it all got caught up now for her to be paid the whole entire year.
Yeah.
So this
Okay,
was
thank you.
basically paying her for more like a year's work rather than a quarter's work. Is that correct?
Correct.
Got it. Thanks, Tina. So
Okay.
that's the big number, Donna.
All right, thank
I
you.
remember I sat in, I
Yep.
lurk on some of the committee meetings and I couldn't remember what it was, but I knew it was legit.
Yep.
We did
Well,
discuss
Tina
it in the
remembered,
meeting.
so we're all set on that. Thank you.
All
Well,
right.
yeah.
Anything further, Donna?
No, that's all.
Okay. Any other concerns with the paying the vouchers, or should we pay the bills? Could I hear a
Pay the
motion to pay
bills.
our bills?
So moved, Monk.
Okay, thank you, Dr. Monk. Got a second to pay the bills?
Second, Hireman.
Thank you, Matt. Can we just do a voice vote on that, Eric? I think we can on these, can't we? So without objection, okay, unanimous to pay the bills. So what's the next item, Ted?
The next item on there is I'm going to require a motion that after we've reviewed the approval of the transfers of appropriations for the month of November 2020.
All right, we need a motion to approve the transfers of appropriations. Does someone
I so
need?
move. This is Donna.
Okay, thank you, Donna.
Second, Fernandez.
Okay, is there any objection to the transfer of appropriations? If not, unanimously approved. Any objections? None. Okay, unanimously approved. The next thing is
The next item is need a motion to approve the changes in the revenue estimates and expense appropriations for the month of November 2020.
Okay, could someone read that for us, please? Isn't there
Also move. It's Donna.
Okay. Does that need to be read into the record, Ted? Is
No,
this the
no,
one?
I think this,
No,
as
we
long
don't?
as we get the motion and get it approved, we're good.
All right, so we have a motion from Donna. Do we have a second, please?
Monk will second.
Monk seconds, thank you. Is there any objection for the transfer of appropriations? Hearing none, unanimously approved. Next, Ted.
Okay, there's one more motion I'm going to require, but I'm going to wait. I just wanted to add one more item to make sure I'll elaborate with the board. We completed, the auditors completed the 2019 finance report and provided us a draft copy of the audit, which was quite extensive. To make a long story short, the good news is that during this audit, we're not cited for any major issues or any concerns. A couple of minor items that we can clean up that we'll address, go accordingly. And but the one thing, the bad news, unfortunately, is that part of one of the little items that we were addressed that was considered a significant concern was that the organization that we utilize to help put together our data once again let us down and provided the state some incorrect information, which of course we had to go back and correct, and Tina had to scramble to get the information addressed. Fortunately for us, that's been said and done, and this is the last year we're utilizing the services of this particular organization, so that should help us going forward. With that being said, we came out of the audit in real good shape, and I'm happy to say that we can move forward with that.
And I think everybody did receive, Eric, correct me if I'm wrong, I think all the board members received that audit report?
Yes, they should have. Yes.
Yep.
Okay. All right.
With
So
that,
do we need any action there, Ted, or is that just information?
No, that was just information to share with the board.
All right.
Eric, you said something? Mm-hmm.
Yes, go ahead.
Just one last thing before we end the committee report. We did have a discussion. Things are moving fast with COVID, and we'll talk about that in a second down the road here in the meeting. But the concern is looking at some software that we might have to buy that has might have a large price tag. We'll be getting more information on that piece of software, and we'll be having discussions with Audit Finance in the very near future on that piece of software, or the possibility of going with another piece of software. But again, just want to make sure that the board knows that we'll be in extensive conversation with Audit Finance to make sure that we've crossed the T's and dotted our I's.
Just so people are aware, because Eric and I did briefly talk about this in our pre-meeting. I don't know if you want to tell them what it's about, but basically we need to connect our immunization processes to a state database. Right. And this particular software that Eric is looking at would do that automatically. And so we're looking at whether there additional alternatives or what have you, talking with the state about whether they should be the purchaser rather than us of this that allows us to move data from our immunization process into the state tracking database for COVID-19 immunizations. So that's what this software is about.
Yes.
So we'll be coming back to talk about what that expense might be. So is that it for audit and finance, Ted?
That is it. The last thing I require is a motion and to approve the Audit Finance Committee report.
Okay, could we have that motion, please, from a board member?
So moved, Monk.
Dr.
I'll
Monk,
second, Donna.
second, Donna seconds. Any objection to approving the Audit Finance Committee report? Hearing none, unanimously approved. Personnel Committee, Michelle.
Good morning. So we had our Personnel Committee meeting on Monday. First thing on the agenda that we need to do is conversion emergency hire contract tracer to part-time temporary contract tracer.
So we need a motion for that? Is
Yes,
that correct,
please.
Michelle?
Yes.
Could we have a motion from a board member
Monk will move.
All right, do we have a second?
This is Ted, I'll second it.
All right, thank you, Ted. This is
Okay,
to
great.
move a contract employee to full-time employment. Is that right again, Michelle? Do you want to tell us anything more about that or?
Josie's on. Do you want her to help
Yes,
you out?
please. That
All right.
would be helpful.
Sure. This was just a contact tracer that we hired on December 10th as an emergency hire. As you're aware, the cases have been increasing, so I've been continuing to hire. We just needed to offer emergency employment to this candidate prior to the board meeting. So what you're actually voting on is just converting him from an emergency hire to an intermittent temporary position just till the end of the year when the funding expires at the amount of $18 an hour.
Okay. And this is someone who's already been performing at that level and we're going from an emergency to a temporary hire through the end of the year, correct? All right. And we've got a
Okay.
motion to make that happen from Monk and a second from, was it you, Donna? Or who seconded it? Dr. Monk's?
I did,
Matt
Dr.
Harmon
Ross.
did.
That was Ted. Okay.
Ted.
Yep.
All right. So any
Okay.
objections? Hearing none, unanimously approved to switch this person's employment status. So next,
Next, motion to hire community health worker, Healthy Start.
okay, we've been looking for community health workers. So do you want to
Mhm.
make any comments about it or shall we go ahead and approve this hire? This is a full-time permanent position?
Yes, it is.
Okay.
Is this a new position or replacing a vacated position?
This is replacing a vacated position.
And I think it's at 13 something an hour. It's not big ticket for these folks, sadly.
Correct. It's $13.83 per hour.
Okay. Could I hear a motion from a board member for hiring this replacement community health worker?
So moved, Monk.
All right, we have a second.
Postal
I'll
will
second. This is Ted.
Okay, thank you, Ted. Do we need a, okay, so I'll assume it's unanimous unless I hear objection. Are there any objections to hiring this replacement community health worker? All right, unanimously approved. Next item.
Motion to hire nurse reproductive health and wellness.
Okay, this is a RN position. Do you want to tell us more? Is this a permanent full-time position? Josie, do you want to comment?
Sure. This is the nurse in our Reproductive Health and Wellness Center. This is a new position that's been created. We already have one nurse in that area. This would be the second. We're recommending Lisa Gilbert for that position. It is full-time, permanent. It's a bargaining unit under our Ohio Nurses Association. The rate of pay based on her educational level will be $23.78 per hour.
Okay, so could I have a motion to hire Ms. Gilbert?
I have a question when you're ready.
Go ahead, Donna.
I'd like to ask if this proposed nurse to hire is an RN rather than a nurse practitioner or advanced practice nurse, is that correct?
Yes, I believe that's correct.
Correct.
that right,
We-
Gwen?
Two nurse practitioners and 2 RNs in
All
that
right, now,
area.
does this person have any experience in reproductive health?
She comes to us from Flower Hospital in the labor and delivery area.
Okay, working labor and delivery, but not in education or teaching of reproductive health. Is that
No.
correct?
She's actually the most qualified nurse of all the applicants that we have received.
You know, the most qualified of all the applicants, you may have had 2 applicants. And so I'm just asking if there is any experience in the past, but apparently none of them had. But I don't think that the most experienced of all the applicants is necessarily a reason to hire someone. And, but I guess, I think Dr. Ross was in on this as this meeting, and any other medical personnel. Okay. All right. Question.
Correct me if I'm wrong. Dr. Cadigan had reviewed this CD as well.
We do not have Dr. Cadigan review the CVs of nurses, only advanced practice.
Oh, I'm
nurses.
sorry. So this is for an
This
RN
is
position.
just a standard RN. We have
Right.
10 RNs within our agency.
Okay. All right.
Gwen was in on that interview, though.
All right.
Yes,
Thank
of
you,
course.
Barb.
Okay, Gwen, thank you. If that suits your purposes, you're the one in charge there, so thank you.
All right.
I have,
So is there any further discussion on this hire? So we need a second, I think, still. I heard a motion from Dr. Monk, but I don't know whether I heard a second.
This is Fernandez.
Richard? Okay. Have a second from Richard. Any further discussion? Then I will assume without objection that we'll hire this lady.
Okay, great.
All right. Any objections? Hearing none, unanimously approved.
Next is the motion to approve the position description of the community health worker in the harm reproduction program.
The harm reduction program. This is through this is one of our opiate program hires. Is that correct? Josie, do you want to comment?
Sure. And I can defer to Shannon as well if she wants to speak, but this is, we received some additional grant money so that we were able to create this community health worker job description. It's going to, here, let me pull up the job description real quick so I can walk you through some of the terms of it. Its job will be to assist our naloxone SOAR health educator to promote harm reduction initiatives. It will collaborate with other agencies and organizations and other groups. It will work with various coalitions that we already are party to. We'll document activities and we'll further the cause of that program. So this would be a permanent position. It's a non-bargaining unit. As we discussed earlier with the other community health worker would pay that same rate. That's E11 on the pay scale. We do not have a candidate yet for this. We're just asking for approval of the job description so that we can move forward with recruitment.
All right. Well, certainly COVID has aggravated the opioid epidemic. We all know that. And we're continuing to see lots of naloxone used to save lives out there in the community as part of our harm reduction programs, including needle exchange. So if we've got money to hire an additional person to continue to work on this, I think it's a good idea. So we're just approving your ability to begin interviewing applicants for a full-time job in this area. Is that right? Again, Michelle and Josie?
Yes, you're just approving the position and the job description.
Okay, so can
I
we
think
have a motion?
it's also important to emphasize that this is contingent on funding.
Yes.
It says it grant funded and subject to persistence of that grant.
Yep. Okay. So any further comments from the board? I'll need a motion to create this job description and authorize Josie to begin the process of trying to find an appropriate candidate to hire.
So moved, Monk.
All right, we have a second.
Second, Barb.
Barb does, thank you. Any objections from the board on moving forward on creating this position, job description, and beginning the hiring process if we can find an appropriate candidate? All right, hearing none, we'll assume that's unanimously approved. What else do we have, Michelle?
Just a motion to approve the Personnel Committee report.
Okay, could we have a motion from the board to approve the Personnel Committee report, please?
Question, this is Donna. On the items, maybe this was in the minutes themselves, there were items, I think, 1 through 7. They weren't on specific hires. So are we, you're asking?
Lost you, Donna.
Approval of everything that was sent to us, including the minutes? Yes? Is that correct?
I'm sorry, I didn't hear the whole question.
Yeah, you broke up, Donna, so say it again.
Okay, there were, apparently it was in the minutes, there were items 1 through I think 7 that had to do with notification of resignations and terminations and other things. So are we approving that too with your
Yes.
request?
Yes, is there a question about those?
Yes, I do. I have 3 questions. Item number 2, which is entitled Notification of Contract Terminations, Retirements, and Resignations. And I have the name Chanel Jones. What is her position now?
I'll respond to that. Chanel resigned from the agency on November 20th. She was a maternal child health supervisor. That should be in the report.
Now?
I'm sorry, what was your question?
And what, so is that, this is a contract termination, but?
No, she was an employee who resigned.
So Chanel Jones, now I saw her name being on December 8th and some of the minutes that she did one of the interviews or was part of one of the interviews. So when she is resigned totally from the health department?
Any interview I would have conducted with her would have been when she was an employee.
So she is no longer with us. Is that correct? I'm sorry to belabor this, but she's been
Correct. She's no longer with us.
And have we had a post well, she resigned.
An exit interview.
Resigned. All right. Have we had an interview with her?
We did, and Michelle was a party to that interview.
Yes.
All right. And I don't know if we want to get into that now, but at some time I would like to, if possible, discuss that with you. This was a longtime employee, and I think it's something that we might want to discuss, or some other member of the personnel committee who is there.
Would that be something that would be more appropriate for executive session, perhaps, Donna?
Yes.
Maybe at our next meeting?
Yes, who was at the meeting in which she was interviewed?
The exit interview was conducted via Zoom. It was Chanel, myself, and Michelle Schultz.
All right. Yes, I think it should be discussed in an executive session sort of way. This was something that I think some board members might want more information on, and I would. The next one item is item 4. And this is regarding someone who had been a community health worker, as you had just mentioned, Dr. Ross, very important to us and required by a number of grants. So she was one of our community health workers, but that was full-time, I believe. And then she changed over to a part-time contact tracer at a salary that is went from $13.83 to $18 an hour. Now, that's of concern to me in case we would have more of those transfers over. We need both of these people. And so is this happened at other instances that we've allowed someone as a full-time community health worker, maybe needed by a grant to transfer over increased salary? I understand that from $13 to $18. But has this happened before? Is this a new thing? And are we promoting that or trying to keep?
There was Donna, There was a substantial, correct me if I'm wrong, Josie and Michelle, there was some substantial discussion with this employee about this transfer. It was not felt that this was probably completely in her best interest to make this move, but after discussion, she decided she wanted to make the move. You have to remember that there are benefits and things along those lines that this person probably lost in the process of going over to being a temporary contact tracing employee, but this was her decision. And it was, correct me if I'm wrong again, Michelle and Josie, but it was extensively discussed with her. And she still decided to take the position.
I can speak to that a little bit. There were multiple meetings held with this employee, and for personal reasons that I'd rather not discuss and put her business out on this call, this was a move that she requested. She was educated on the pros and cons of the job that she's in, as well as the transfer to the new job. Upon being advised of what those things are, she continued to move forward. We do have a written receipt that she acknowledges the terms of that new employment. And for her, this was a move that she wanted to make. So after going through all those things, we supported her in that move.
All right, thank you for that. I was concerned because we need people in both those areas. Thank you for that explanation. The item number 7, one of our advanced practice nurses in your unit, Gwen, Deanna, for a new contract, and it's only last 6 months. Is this was this a change in salary, or was there a situation why this changed? Less hours, more hours?
It was actually to line up, wasn't it? Wasn't this the contract that we were trying to get to line up in such a way that we weren't having all of our nurse practitioners at a point where they might be negotiating with us at the same time? So it was an effort to create a contract date that would allow some time between the two nurses that are going to be or nurse practitioners that are going to be working there, to have some space between them in case one of them decided to change jobs. So this was a way of kind of protecting our clinic.
Thank you, Dr. Ross. Correct.
That makes sense. Thank you very much.
Any further questions about the personnel report?
Not from me.
Okay, thank you. Any others? Michelle, is there, we still need a motion and a vote to accept your committee report?
I move that we accept the committee report.
Thank you, Richard. Could we have
I'll second it.
Seconds. Thank you, Dr. Monk. Is there any objection to approving the committee report at this point? Okay, then we'll assume it's unanimously approved. Don, do you want to talk about environmental health?
Dr. Ross, if I may.
Yes.
Just very briefly, not to slow us down. I just wanted, because I know that we have some members or some community members watching, I just wanted, do you mind if I briefly just look at the agenda and kind of run down what we have left in the agenda in case some of our
that'd be great. Yeah.
Might
so
need to know whether they want to stay. We have up next Environmental Health Committee report. Then we have a new business discussion of Board of Health elections. That'll be our health commissioner. And we have prior business. This will involve a COVID update. We'll discuss a new motion, or an extension of our stay-at-home advisory. We will discuss mass vaccinations, get an update from our health commissioner. And then we'll have health commissioner's comments. Then we'll go to Dr. Ross for other items, public health in the news. And then we will give notice of our future meetings, and then we will adjourn. And that was just so that any folks looking ahead, waiting, know whether or not there's anything on the agenda to look ahead to. Apologies for the interruption. Hopefully that was helpful for anyone watching, since we have a lot of people in the room.
Okay. Thank you, Richard. That was kind of you and thoughtful. All right, Don, do you want to proceed with the Environmental Health Committee report?
Yes, we had a meeting on December the 9th, and we had 4 of the regular members in attendance, and there was 2 items on the agenda. The first one is a variance for the water system at 160 Harrison in Providence Township. That's in Super West Lucas County. I believe it abuts the Fulton Lucas County line. Anyway, this is a point well, which typically is a 15 to 25 foot point well, goes down in the ground. Sometimes it's used for water supply of the house. Sometimes it's used by farmers for watering of the crops and so on. Anyway, there's been some utility. First of all, this has been in the ground for quite some time. A new well has been drilled and established for the residents, and some of the utility lines, gas, I believe, and sewer lines have went through there, and it's just unavailable to locate the existing point well that was there. So we do have a requirement to request a variance under the Ohio Administrative Code. All private water systems that are not providing a source of water for human consumption need to be properly sealed or decommissioned. The driller has been unable to find that, and with the sewer lines and gas lines that went through there, it's just not available to properly decommission. So they've requested, the owner of the property has requested a variance for that, and we've granted these kind of things in the past. So it was a complete recommendation. Go ahead.
Yeah. I just was going to ask, is there any real risk to public health by not sealing this well?
No, not, it doesn't provide anything, and it's an individual point
So
of
we
distribution.
just have a well that's non-operative that's out there. Normally, if we could, we would make sure it was sealed. In this particular case, we can't find it, so we're going to grant the variance. Is that correct? Do I have it right?
That's the recommendation, number one. And number two, it only goes down probably a maximum of 25 feet. Dave or Eric, you can correct me if I'm wrong on that, but it's not something that goes down into bedrock like 80 to 100 feet and then picks up the lower aquifer down there. So.
Okay. All right.
Okay.
So
Any questions?
do we need a motion to approve that variance then?
Yes, we will. It was a recommendation of the Environmental Health Committee, unanimous, that we approve this variance.
Okay. Could we have a motion to approve the variance, please, from one of the board members? Or further questions?
Motion to approve.
Matt Hireman.
Matt moves. Do we have a second?
I'll second that.
Is that Donna that seconded? All right. Are there any objections to approving this variance? Hearing none, the variance is unanimously approved. Other business, Don, from the Environmental Health Committee?
The discussion of from the city of Toledo, the memorandum of understanding, it's still in the process. Thought we might have something for this meeting, but we did not.
This
So maybe
is on
next
lead.
meeting.
This is on the lead remediation.
Lead safe, yes, with the BP Husky. So anyway, that then ends the Environmental Health Committee report. And unless anybody has any other questions, I would need a motion to approve that Environmental Health Committee report.
All right. Thank you, Don. Do I hear such a motion from a board member, please?
So moved, Monk.
Thank you, Dr. Monk. Do we have a second, please, to approve the committee report?
Second, Barb.
Thank you, Barb. Are there any objections to approving the Environmental Health Committee report? Hearing none, the report is approved. Eric, you're back on.
Thank you, Dr. Ross. The next item of business is Board of Health elections. We do this every year. Usually we have a nomination committee, which Don Murray has been graciously accepting year after year to lead that charge. So we'll need to get that committee together to, again, look for nominations for board president and vice president.
And that election will occur next month.
Correct.
Is that correct?
That is correct.
Okay. Do we need action on that, Eric? Don?
Don has a hand here first.
Go ahead, Don.
Any motions or any nominations could be sent either to myself or to Michelle Schultz, who chairs the Personnel Committee, or to Eric, or to Dr. Ross, or to Ted Kazarowski. We accept them, and then we will also have nominations from the floor in the month of January. So that's the avenue for the new members to submit any names for a nomination for president and vice president of the Toledo-Lucas County Board of Health.
Okay.
That's all I have.
Do we need to is there any reason for a vote on this at all, Eric, or just this is letting everybody know what the process is?
No, it's just something coming up, that's all. We'll
Just
vote
a
in
process,
January.
okay. So people, Any of the board members, if you've got interest, please talk with me or with Eric or with Don or with Michelle about the possibility of leadership on the board.
Okay,
All right, Eric.
if I can interrupt for just a second, Dr.
Sure, go
Ross, I
ahead.
have a squad, I can go on, so I got to beg off this committee or this.
You're going to sign off
meeting.
right now. Is that what I'm hearing?
I hope,
Okay.
yes, yes.
All right,
Thank
that's
you.
fine. Thank you. Thank you for your service, Don.
Thank you. Bye-bye.
So I guess we're into prior business. Is that right, Eric?
Yeah, that is correct, Dr. Ross.
Okay, so you wanna,
Yeah, let me do this. I'm going to give kind of a COVID update, but I'm going to do something here to talk about the health of each one of us. COVID has spiraled us out of control in so many different ways, whether it's in our business, in our family lives, with our health. And I know firsthand that this happens. We've seen commercials that have been developed by the Ohio Department of Health and other agencies about seeing your doctor. It is so important. I know that we're scared to maybe go into a doctor's office because of COVID. I know early on with COVID, we had a concern that, again, doctor's offices were locked down. Most of them are back in operation, and they've taken protocols and procedures to actually get in and see them. So please, go see your doctor. Firsthand, my wife was diagnosed with breast cancer last Friday. I say this because at the very start of the year, she was supposed to get her mammogram. We had to hold off. She was actually going to hold off again, but we said, let's get it done. If she would have held off any longer, we could have really had some real concerns with her diagnosis. So again, I urge everybody, go out and get your screenings done, whether it's a mammogram. If you have other screenings you need to do, go out, make your appointment, get that taken care of. The other issue that we have, if you're having heart pains, do not sit on your couch because you don't want to go to the ER because of COVID. Get help, seek help, get medical attention. Again, even going to the dentist, get your medical care taken care of. Do not wait. It's not worth it in the long run. I know firsthand. And again, when you come up with a diagnosis that maybe you could have had months ago, you continue to just compound that concern and then cause stress in your life. Get it done, get it taken care of, seek medical professional help when you need it. Do not wait. So that was my advertisement today, kind of coming off of what I've just experienced, but also then too, the things that we're seeing on TV with the commercials. Again, pay attention to those, pay attention to body, pay attention to getting to your doctor and what he or she says you need to do. With that said, COVID update. I don't want to say we got good news, but we might have some good news here with numbers. We're still extremely high. The beginning of the week, we're about 945 per 100,000. We've been under 900 for a number of weeks. So that, we've kind of encroached that 900 mark. Right today, we're at about 812. So early in the week, we were extremely high. We've dropped down. And our daily numbers, we're seeing, it's interesting. We're seeing now kind of this downtick. Again, we're extremely high. Don't get me wrong. I mean, it's nothing to really clap about, but it's just something to take into account where our numbers are going. We think we'll be able to tell more over the weekend how our numbers are. Right now, we're holding steady about 280 per day over the last, let's say, 2 or 3 days. So that is a good thing. We're not seeing as many come in, if you would, daily. So don't forget, we get the positives in, and then we put that into our spreadsheet. We start doing our contact tracing. So, we're, by 10 o'clock, we're already seeing like 100 cases come in. And lately, over the last couple of days, we've seen that under 100 earlier in the morning. So again, we've been doing this for so long, you get this gut feeling on where we're going. So let's hope we're seeing this downward trend. The issue about going red or purple, I can safely say we're probably going to stay red again today. We'll hear later on in the afternoon. How are we faring in the state overall? There is some good news from the hospitals in the sense of the issue with employees, nurses and doctors getting COVID, having to, again, be at home and don't have the personnel to take care of individuals. we're stabilizing there from the information that we're getting. So that is a really good thing. It's good for our healthcare system. We are seeing, though, utilization of our hospital system. So don't get me wrong. I mean, it's not like all of a sudden we're seeing a drop off. We are seeing definitely the numbers in the community. And I think the other thing that I want to talk about right now is testing. We still need testing in our community. The big box stores are still testing. We're holding up another pop-up testing, and you know, we've done a lot of these recently over the last month or so, but I think with the holidays and everything, it's important to, again, offer it. You know, I would have liked to have gotten it done this week, but we're not going to be able to, again, because if we get it done this week, it kind of gives people an idea of really how they're going to be over the if you would, the Christmas holiday. You know, really should they really just stay at home because they have COVID? Yes, they know that from the pop-up testing or from testing in general. So we're going to have pop-up testing on Monday, December 21st from 10 a.m. to 2 at the Lewis County Fairgrounds, again, building number 2. So the rec hall number 2, same place we've done the last couple of times. They've been fantastic, a great spot to do it in. It seems like it flows very well. We were lucky enough too that Mako, who did our last pop-up testing, we got results back really quick. Right now we're at 4 to 5 days for community. Mako, for whatever reason, turned it around within 24 hours. And so we were really happy about that. Hopefully we can do the same thing here. And then people can kind of understand where they're supposed to, where they are relative to COVID and really what they should be doing. What they should be doing for the holidays. I think you've heard it from the governor, and again, the update on COVID. And I think you heard this too from Dr. Fauci as well too, is, you know, really, we probably shouldn't be, you know, going outside of our immediate bubble at Christmas time for the holidays. And that's hard to say, ladies and gentlemen. You know, there's this mental concern that we all have about seeing our family. Again, I haven't really seen my extended family, brothers and sisters, sister-in-laws, brother-in-laws, really almost a year now. I saw them, I think, at the first of the year last year. So it is difficult for my family. But again, everybody needs to make that choice. And the choice should be for the health of your family, the community. Again, don't go outside that bubble. If you do, really pay attention to, you know, the things that we talked about at Thanksgiving, you know, social distance, do things the right way when you're together, really limit the number of people in your house. I'm hearing too from some of my friends, they're doing outside Christmas Day with family. I guess bonfires and you know, sipping hot chocolate outside and exchanging gifts that way. Again, that's better than being inside. So again, we'll be messaging more over the next couple of days for Christmas, or excuse me, for the holiday season. So that'll help, I think, us a lot in the community. I do want to ask if the board could go ahead and approve a motion to extend our current stay-at-home advisory to January 3rd of 2021. Please remember, this is the advisory. This is not an order. This is an advisory. And it really kind of directs people on what we should be doing. And that really is staying at home, not going out unless it's essential, things of that nature. So I would ask Dr. Ross if that's okay for a motion there.
Okay, Eric is asking us to extend our stay-at-home advisory. Again, not an order. It's our best advice for how people can stay safe in the community. And we'd like to extend that to January 3rd. Is that correct, Eric?
That is
that what
correct,
I just
Dr.
heard?
Ross, yes.
So could we have a motion to extend our stay-at-home advisory until January 3rd?
Dr.
So
Ross,
moved,
before we
Monk.
have a motion.
All right, Matt Hireman moves.
No, I was at a question, Dr. Ross, before.
Okay,
we
go ahead
move.
then. I'm sorry.
Eric, could you just explain why the timing of it? Why did you select January 3rd?
Again, it's after the holiday. The governor is looking for his curfew to be extended till January 3rd. Speaking with other health departments who, again, went in as a group, they're extending it to January 3rd.
So this helps us line up with the state's advice. Is that basically what you're saying, Eric?
Basically, yes.
Yeah, okay.
Okay, thank you.
Sure.
So we still need a motion to approve extension of our stay-at-home advisory, not an order, until the 3rd.
Yes,
So moved.
Thank you, Amr. Do we have a second?
Monk will second.
Thank you, Dr. Monk. Is there any further discussion about extending our stay-at-home advice our advisory to the 3rd of January? Hearing none, any objections to this? Hearing none, unanimously approved, Eric.
Thank you. We'll make sure we make that correction to the advisory and move that forward. Dr. Ross, if it's okay, I'd like to move on to mass vaccination update.
Please.
Again, you know, this is a moving target on a consistent basis. You know, we're looking to get vaccine in. We did get vaccine in from Mercy Hospital. Again, I can't say enough about Matt Sapara and Mercy and their commitment to the community and taking on the first delivery of vaccine from Pfizer. And if you remember, that vaccine is a little hard to deal with and to handle. It's negative, I think it's 70 degrees Fahrenheit that has to be kept at. So it's a hard one to really deal with, and they've done a fantastic job. They've already started vaccinating their priority groups inside the hospital. So again, great thing that continues to move on as we get more vaccine in for Mercy, and they're going to go ahead and vaccinate as directed by the Ohio Department of Health. With the health department, we should be receiving vaccine next week. We're hearing the 22nd possibly, but again, who really knows the exact date and or the exact quantity? We're thinking, you know, over 2,000 doses possibly by January 1st that we'll have in our, if you would, in our possession. There are stipulations. There's these priority groups that are set forth by the federal government and also then the Ohio Department of Health that give us kind of a really good working framework, and we've developed some priority groups. Again, I would highly suggest that those might change here. Matter of fact, the other night at 10:30 at night, I got an email from the Ohio Department of Health relative to a change in the priority groups. So again, like I said, it keeps on changing. But as we go on over the next day or two or three over the weekend, we'll be able to really hammer out more of the priority groups, and they are extensive in the sense of, you know, 1A, if you would, 1A1, 1A2, 1A3, 1A4. And so we'll be able to, again, be sharing that with the community here soon. Again, the limiting factor right now is vaccine. You know, if we were given 200,000 doses of vaccine, you know, next week, that's easy to plan for and get that out to the community. But the problem is it's a trickle. The fire hose will probably starting in January, February. And then the dam will break, I do believe, after that to get more vaccine in the community to the point where we would be doing mass vaccination clinics like we did with H1N1. So there's a lot of partners here. There is a very large group right now that has been meeting over the last 2 weeks, and they're community partners. The participation was about 150, I do believe, on a Zoom call. And this is really, really getting down in the weeds with different organizations to make sure whether they're businesses, faith-based organizations. Sean Savage has been helping us spearhead this, actually his idea about how we can maybe move this group to do better things in the community for mass vaccination. The idea here is you're going to want as much information down into singularities, so down to individuals as much as possible, and that information has to be, you know, exact and you know, make sure that it's factual and that we get as much down as possible to the single individual. So again, these groups are going to be able to do that. They're also going to help out. I got to tell you, this is going to be a logistic nightmare. And you know, yeah, we did H1N1, and I'm very proud of this department for what it did. This is going to be a different lift. This lift is going to be such that, you know, again, we want to be effective. We want to be efficient. We want to make sure that we get, you know, the vaccine into people as fast and effectively and safely as possible with the least amount of stress to the system, because again, there's going to be other stresses. So I've already talked to one individual about helping us with logistics from this group, who's going to be getting a committee together. Again, this is a great public-private type of partnership. Marketing issues as well too. So more to come on that group as you hear in the coming days and weeks. I'm really excited about it. What I'm not really excited about is not having vaccine. And so again, like I said, that is the limiting factor. But like I said, hopefully we'll be able to come up with a game plan for these first couple of weeks that really does get vaccine into people's arm as fast as possible. The thing that I don't like too is the idea of some of these stories out there about how bad the vaccine possibly is. So there's going to be a lot of fact checking. The vaccine, again, has gone through a rigorous process to be studied. Have we studied it for 10 years? Absolutely not. But we've reached that aspect of scientific and research rigor that I'm very comfortable with getting it. But like any vaccine, there of course are going to be certain aspects that again happen, but they're very small and minute. But everything that we do relative to drug, and that there's doctors on this call that say yes, there are things that happen that are really out of the ordinary. So again, we need to make sure that it's very factual when we get this information out. This group here that you have in this department has been doing contact tracing for months now, and I will tell you, they've done a marvelous job. They are, I think, burnt out. We've over the last couple of weeks, we've done tens of thousands of calls, if you would, between those that are actually infectious, have COVID, but those then we have to contact. However, they are for this task of mass vaccination. Be assured of that. We've had conversations with many in this department, assigning them duties and already looking at mass vaccination clinics and how do we set pods up and things of that nature. Even with all the unknowns that we have, we need to continue to plan and make sure that we can pivot on a moment's notice, which this department will do. But the staff is ready, and I think they're eager to pivot to doing something that is a little bit different than contact tracing. With contact tracing, just real quick, it does dovetail into how we're going to operate in the near future, because again, this department is going to have to look at mass vaccination concerns, and as we shift contact tracing to mass vac, we already have a plan in place for our part-time tracers. We're working with the Ohio Department of Health. We're working with other entities to make sure that the contact tracing that we need to do will be taken care of. So again, we're making plans for that. I think right now that is it for mass vac. More to come. And like I said, it does change on a consistent basis. Dr. Ross, you're on mute.
Thank you very much. Any additional questions for Eric about either our current status on COVID or on mass vaccination? All right, I don't hear any. So are we at my point in the agenda here?
Yeah, my comments are fine, Dr. Ross. I've said my piece already. So
all right. Any additional questions at all from the board for Eric about our plans, both with regard to controlling the COVID pandemic, or with the mass vaccination plan that we're evolving? Obviously, he was emphasizing the complexity of this. So again, as Eric pointed out, at this particular point, we are limited in terms of the amount of vaccine that we'll have. Almost everybody who's looked at this from an ethical perspective says that given our caregivers and others who are in the direct line of fire, should be among the first to be vaccinated, given the necessity of the healthcare personnel for saving our lives if we do get sick from not just COVID, but from whatever other illness we might have to suffer. So again, appreciate the fact that at least we're beginning to get our first responders and our healthcare personnel vaccinated and hopefully protected. Maybe I'll just make a couple of quick comments on this. Again, there was a lot of concern because the vaccine had been somewhat politicized, but for those that don't know the process, the Food and Drug Administration has independent reviewers, not just people who are connected to the drug companies who have looked at the data. And that's why we've seen, at least initially, the Pfizer vaccine approved. And I think probably a very good chance next week, the Moderna vaccine will be approved. And then there are several other vaccines that are in the pipeline by other companies, which will come aboard probably in the next 1 to 2 months. So the availability of vaccine will increase. So far, the safety and effectiveness of these vaccines in the studies that have been done seem to be pretty good. They're not perfect. Some people are having, much like people do with the flu shot, a day or so of feeling crummy following the shot, but the vast majority of people feel okay. It looks like these vaccines are working as well in the elderly. We do not have information about in kids. There was no children in the study so far, so we don't know about those under the age of 17, whether this vaccine will either be effective or well tolerated. Just so everybody knows, we will not be safe once the vaccines are given. First of all, it takes 2 shots for some of these vaccines, which means that you're at least 5 weeks from your first shot before you might be considered relatively safe from this. There have been some cases in people who received the vaccine who then went on to get COVID, but their symptoms were markedly reduced. We see that also with the flu vaccine. So these are not perfect. There's been a couple of severe allergic reactions. They tend to be in people who have already had severe allergic reactions. And within our planning for mass vaccination, we're going to make sure we've got the appropriate personnel and emergency response available if someone was to have an emergency with regard to this vaccine, a sudden severe allergic response. So we will be prepared for that as part of our mass vaccination campaigns. There are still, as Eric said, this is a lot of logistics that go into this as well, making sure we document that a person's received the vaccine and that we have a way of reaching them to make sure they get the second vaccine. So those issues are going to persist. And so we have to be aware that it's going to be several months that we're going to be engaged in this at the least. In the meantime, just to beat this down, I mean, we've got to do the things that are going to protect us in the meantime. And that means the same old, washing your hands, wearing a mask, not getting into crowded areas, reducing the size of gatherings for your family, avoiding or planning off into the future for weddings if you can, trying to be as socially distant as you can and to not go out other than for absolutely necessary purposes. So the less we gather, the less disease, the easier it'll be for us to relax any restrictions that we put on our community. And so it won't immediately change. We're going to see COVID into the future. Not everyone will get vaccinated. There'll still be cases of COVID in those that were not vaccinated. There'll be much fewer of them, but that is 6 months to a year away from the time where we finished our mass vaccination program. So everybody needs to understand that. So we need to continue to do the same basic things that we've done. And one last comment, and then I'm done. Both the flu and this COVID start the same way. Body aches, headache, fever, feeling crummy, and a cough. And if you don't get your flu shot, it's going to be really confusing to the doctors. So please, 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 anybody out there who's listening, get your influenza vaccine, because it's going to make it way easier on the medical personnel to sort through if you happen to get sick and come in with these symptoms, because at least initially the symptoms can be very, very similar. And the flu vaccine is quite safe and effective. So please, if you have not already done it, get your flu shot. So that's my final message of the day. Do we have any other comments that the board would like to make? Any board members who haven't? Go ahead, Donna. Yeah.
Yes, there will be tonight a town hall meeting put on by the University of Toledo and announced by the Dean of the Medical School. This is about COVID facts and myths. They will have some clinicians, particularly I wanted to mention Dr. Joan Duggan is one of the main speakers. We've worked with her for many years, sharing grants and working together on all sorts of important public health issues. And also they'll have virus specialists from the main campus and a number of people. So this town hall is, they wanted the health department to be aware of it. If you're interested, it starts at 5:30. There is no fee. They only ask for registration. Jonathan, maybe you got yours.
Yeah, I'm going to be on. I will participate this evening. I've already registered.
Wonderful. So I asked too, Dr. Zagzinski, if it's okay with you that we send that out to the board members. Again, you only have to register for it, nothing else. And you can watch part or all of it. I think it might be, we get from those actually working with viruses and very knowledgeable. I mean, I'm not saying we're not, but this is in a different sense, sort of delving a little bit deeper into the science of it. And so if it's okay with you, we'll send that out to board members and any other people who might be interested. Let us know. We can get that out. That's tonight at 5:30. You just need to register, and if we'll send that to board members. Thank you.
Okay. Will you send that notice to Eric so he can forward it then, Donna? Would you do that? Forward the notice to Eric?
Dr. Ross,
I may
already
have
sent-
it somewhere.
I just sent it out, Dr. Ross.
All right. Thank you very much, Eric. All right. So I think we're ready to adjourn if I'm correct. I mean, our next meetings are scheduled for January 28th, February 25th, and March 25th right now. Just as an FYI for calendars for anyone who's participating, January 28th, February 25th, and March 25th. And obviously with the COVID emergency, we've been sometimes having to meet sooner than that. So we'll see, but there'll be notices out if we're going to. So I would entertain a motion to adjourn.
I so move. It's Donna.
All right. Thank you, Donna. Do we have a second?
Yeah, Amr.
All right. That's Richard, I believe. Are there
That's
any
Amr.
objections? Who was, I'm sorry, am I correct? Or
That was Amr. We have about the same tone of voice and the same
and a
timbre.
nice deep baritone. I love it. Anyway, so any objections to adjournment at this point from any of the board members? Then we will be adjourned until our next scheduled meeting, January 28th, although there may be interval actions. So we'll find out. All right, thank you, everybody. Eric, did you want to stay on with Amr to discuss?
Sure, let's do that.
Committee? Okay, so
Happy
everybody.
holidays, everybody.
Happy holidays.
Thank you very much. Yes, please be safe.
Thank you.
No crowds, guys. We need y'all. All right.
Amen.
All right.
Be well.
Bye-bye.
Bye-bye. So Amr, are you still on there?
Yes.
All right, we're gonna wait a minute and let everybody else kind of get out of this Zoom meeting, and then we'll talk. Mostly, I usually we would be doing sort of and I don't know if this